Human Metapneumovirus, HMPV. Understanding the silent respiratory threat. Respiratory illnesses affect millions of people worldwide, and while many are familiar with viruses like the flu, COVID-19, or RSV, there's another hidden player in the respiratory virus arena that deserves attention: human metapneumovirus, HMPV. Discovered relatively recently in 2001, this virus has quietly become a significant cause of respiratory infections, particularly among vulnerable populations. This comprehensive guide dives deep into HMPV, covering its symptoms, risks, transmission, prevention, and why you should care about this silent invader. What is human metapneumovirus, HMPV? Human metapneumovirus, HMPV, is a respiratory virus that belongs to the Paramyxoviridae family, the same family that includes well-known viruses such as RSV, respiratory syncytial virus, and measles. Despite being a relatively new discovery, studies suggest that HMPV has been circulating in humans for decades, if not centuries. Its primary target? The respiratory system, lungs and airways. Symptoms of HMPV. What to watch for. HMPV can present with a range of symptoms, from mild cold-like signs to severe respiratory distress. These include mild symptoms: runny or stuffy nose, sore throat, low-grade fever. Severe symptoms: high fever, wheezing, shortness of breath, bronchiolitis, inflammation of the small airways in the lungs, pneumonia, lung infection. Severe cases are most commonly observed in high-risk groups, but even healthy individuals can sometimes experience complications. Who's most at risk? While anyone can catch HMPV, certain groups are particularly vulnerable to severe illness. Infants and young children. Their immune systems are still developing, making them less equipped to fight off infections. Older adults. Aging weakens the immune system, increasing susceptibility to severe symptoms. People with chronic medical conditions. Those with asthma, chronic obstructive pulmonary disease (COPD), or heart disease are at higher risk. Immunocompromised individuals. Patients undergoing chemotherapy, organ transplant recipients, or those with autoimmune diseases face increased risks due to suppressed immune systems. How does HMPV spread? HMPV is highly contagious and spreads in several ways. Respiratory droplets. When an infected person coughs, sneezes, or even talks, tiny droplets containing the virus are released into the air. Surface contact. Touching surfaces contaminated with the virus, like doorknobs, phones, or countertops, and then touching your face can lead to infection. Close contact. Being in close proximity to someone who is infected increases the likelihood of transmission. The virus can survive on surfaces for hours, making it particularly easy to contract in crowded or shared spaces, such as schools, hospitals, or public transportation. Diagnosis of HMPV. How is it identified? Diagnosing HMPV can be tricky because its symptoms mimic those of other respiratory viruses like RSV, influenza, or even COVID-19. Doctors typically use molecular tests such as PCR testing to confirm the presence of HMPV. Samples are usually taken from the nose or throat, and in some cases, broader respiratory panels are used to detect multiple viruses at once. Treatment for HMPV. What can be done? Currently, there is no specific antiviral treatment or vaccine available for HMPV. Most cases are mild and can be managed with supportive care, including staying hydrated. Drinking fluids to stay hydrated helps thin mucus and eases congestion. Fever management. Over-the-counter medications like acetaminophen or ibuprofen can reduce fever and alleviate discomfort. Rest. Adequate rest allows the body to focus on fighting the virus. Oxygen therapy. In severe cases, hospitalized patients may require oxygen or ventilatory support to help with breathing. While HMPV cannot be cured with medication, early medical intervention can help prevent complications, especially in high-risk individuals. Why you should take HMPV seriously. HMPV is not just another cold virus. Studies have shown that it is one of the leading causes of respiratory hospitalizations in young children and older adults. It often circulates in the late winter and spring, coinciding with other respiratory illnesses, making it easy to overlook. Moreover, HMPV infections can exacerbate pre-existing conditions such as asthma or heart disease, leading to severe outcomes or even death in some cases. Prevention: how to protect yourself and others. Since there is no vaccine or specific treatment for HMPV, prevention is the most effective strategy. Here are steps you can take to reduce your risk. Practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds. Use alcohol-based hand sanitizer if soap and water are not available. Avoid close contact. Stay away from individuals who are sick, especially if you are in a high-risk group. If you're feeling unwell, stay home to avoid spreading the virus to others. Clean and disinfect surfaces. Regularly clean high-touch surfaces such as phones, keyboards, and doorknobs. Cover your coughs and sneezes. Use a tissue or your elbow to cover your mouth and nose, then wash your hands immediately. Wear a mask in crowded areas. Wearing a mask can reduce the spread of respiratory droplets, especially in crowded or indoor settings. Raising awareness: why it matters. Despite its prevalence and potential severity, HMPV remains relatively unknown to the general public. Raising awareness is crucial for several reasons. Early detection. Knowing the symptoms can prompt individuals to seek medical attention earlier, potentially preventing complications. Preventive measures. Increased awareness can encourage better hygiene practices and reduce the spread of the virus. Support for research. Public knowledge and advocacy can drive funding for the development of vaccines and treatments. The bigger picture. HMPV in the context of public health. HMPV highlights the importance of understanding and addressing respiratory viruses as a whole. While viruses like COVID-19 have dominated headlines, other pathogens like HMPV continue to pose significant health risks, particularly to vulnerable populations. Integrating HMPV into public health discussions ensures that resources and attention are allocated to combat all respiratory illnesses, not just the ones making headlines. Conclusion: stay informed, stay safe. Human metapneumovirus, HMPV, may not yet be a household name, but its impact is undeniable. By understanding the symptoms, risks, and prevention strategies, you can protect yourself and your loved ones from this silent respiratory threat. Spread the word, stay vigilant, and remember, knowledge is the best defense against HMPV and other emerging health risks. Human metapneumovirus, HMPV, is gaining attention in China due to rising cases, particularly during its seasonal peak in late winter and spring. The virus spreads through respiratory droplets, contaminated surfaces, and close contact, thriving in densely populated areas like urban centers, schools, and public transport. Overcrowded healthcare facilities, already burdened by simultaneous outbreaks of COVID-19 and influenza,